I'm Dr. Ali Guerami, a reproductive endocrinologist and infertility specialist at Fertility Specialists of Texas. Many patients, and frequently, they ask about implantation, want to know what implantation is. The process of implantation is very, very complex, which involves many hormones and protein products in the uterus, in the fallopian tube, and within the lining of the uterus, which would probably take hours to go into details of this process. Basically and simply stated, when the ovulation occurs, the egg gets into the fallopian tube, and the sperm would reach the egg, enters the egg, and this is fertilization. After fertilization, the embryo would spend 2-3 days in the fallopian tube, which functions as the initial incubator for the embryo. The embryo grows, develops from 1 cell to 2, 4, 8, 16, 32, and about 3-4 days later would reach the endometrial cavity, at which time the embryo is at about 16 to 32 cells, which then turns into a blastocyst, which has about 35 to 250 cells. The blastocyst is surrounded by a shell that the embryo needs to get out of that shell, which is hatching. The movement of the embryo within the fallopian tube and exposure to the fluid within the endometrial cavity results in lysis and breakage of that shell, after which the embryo exits the shell, and this is hatching. And then it attaches to the lining of the uterus, which is a process of attachment. And then the word invasion is used, which is the cells that are eventually resulting in formation of placenta attached to the lining of the uterus, and then literally invade the lining of the uterus and eat their way into the lining of the uterus. But I think a little bit more gentle word should be considered at migration. So I would say the embryo at blastocyst stage, after spending a few days within the endometrial cavity, attaches to the lining of the uterus and migrates into the lining of the uterus, and that is implantation. Many factors could affect the implantation. Some of the most factors are the quality of the embryo. Not all embryos are good, not all embryos can implant. The age of the mother, and the quality of the endometrial lining, the hormonal response and treatment of the patient, whether the embryo is with normal chromosomes or abnormal chromosomes, previous surgery on the lining of the uterus, infections affecting the lining of the uterus, a patient weight. Excess weight can affect implantation, and certain untreated or uncontrolled medical problems like diabetes can also affect implantation. How complex the process of implantation is, sometimes I think about implantation like the stories of Ulysses in ancient Greece, that gets on his ship and gets into the ocean with so many problems involved and so many ups and downs. You can look at the embryo like Ulysses sailing his ship through the fallopian tube ocean and through the endometrial cavity ocean, which has to go through a lot of ups and downs and face many, many problems till you get to your destination, which is the endometrial cavity and endometrial lining, and get implanted.